I try to imagine a fellow smarter than myself, and then I try to think, what would he do?
Charge up your axons, ready your receptors, and shift your lobes into upper beta phase. You are listening to Smart Drug Smarts, the podcast dedicated to helping you optimize your brain with the latest breakthroughs in neuroscience, nootropics, and psychopharmacology.
Hello and welcome to Smart Drug Smarts. I'm your host, Jesse Lawler, excited to bring you the 25th episode of this podcast, and I'm actually recording it on Christmas morning. It is an early Christmas morning. Got up before it started getting noisy around here and figured I would get the segments banged out for this episode. You'll probably get it a couple days after Christmas, and in fact, those of you who are listening on iTunes, who's probably most of you, I think iTunes is not publishing any new podcasts until the 28th, so it'll be a couple days late, but anyway, I'm feeling somewhat Christmassy. And of course, somewhat smart drugsy, because this is the podcast where we like to talk about smart drugs and nootropics and pretty much anything that you can do to make yourself smarter, particularly if it is not what nature intended. We've got an interview today with Dr. Lucas Koberda of the Tallahassee Neurobalance Center, and he's going to be talking to us about neurofeedback, and in particular, a strain of neurofeedback called LORETA, the LORETA method. Yeah, that's not a woman's name. Well, it is, but it's an acronym in this case, and we'll find out what it's for and what he's doing down there in Florida with neurofeedback in the main meat of this interview. But if you hang around until the very end of this episode, I'm going to give you an unexpected upside to the drinking of alcohol, which, yes, is a neurotoxin, and we should never be saying anything nice about it. I don't actually drink any alcohol myself, but I did find this article on the Reason Foundation's website and thought this was kind of interesting. And in the spirit of honest journalism, I should probably bring this alcohol upside to your attention. But before we get into any of that, let's do This Week in Neuroscience.
Smart Drug Smarts. This Week in Neuroscience.
So a recent study published in Brain magazine was titled "The Corpus Callosum of Albert Einstein's Brain, Another Clue to His High Intelligence." It turns out that they've recently taken, I guess this was in 2012, they took a bunch of super high resolution scans of the two halves of Albert Einstein's brain, which have been preserved. And these photos were requested by, I'm going to butcher this name probably, but Wei Min of East China Normal University's Department of Physics, who studied these photos with some advanced imaging techniques and proved fairly definitively that the corpus callosum of Albert Einstein, the corpus callosum is the largest bundle of nerve fibers that connect the two halves of the brain, and where the majority of interhemispheric communication takes place, that Albert Einstein's corpus callosum was higher than control groups, both of elderly men, which were similar age at the time of death, and also people that were born during the same birth year. So two control groups, one people that died at the same age, one people that were born at the same time. Albert Einstein's corpus callosum mopped up the competition handily, I guess, in both groups, possibly not surprisingly for those of you that are big Albert Einstein fans and know just how incredibly smart that guy was. So can't necessarily say big corpus callosum equals big intelligence necessarily, but on the other hand, there's not any reason to think that might not have something to do with it either. Further studies are in progress.
Smart Drug Smarts.
Alrighty, so it's been a little while since we had a neurofeedback themed episode of this podcast. We have had a couple. We had, I believe, episodes 4 and 12 were both neurofeedback themed stuff, but even episode 12 was way back in April, so it's been a little while, and I certainly understand if you guys are not necessarily all longtime listeners who have been privy to what we talked about on those earlier episodes. So I want to give a quick little summary of what neurofeedback is. So as we all know, our brains work based on a huge amount of electrical activity going on all the time. When you're awake, when you're sleeping, all that stuff. Your brain is constantly abuzz with electrical activity, but normally we don't have any way of perceiving it directly. And what neurofeedback is it basically gives the brain a way to listen to its own electrical signals and noise. Now, listen would normally be an inaccurate metaphor since we don't have a direct sense for perceiving electrical activity other than shocking yourself when you put your fork into an electric outlet. But in this case, it really kind of is listening. There's sort of two kinds of neurofeedback that people use. One would be visually based, where you're getting the information about what the electrical signals are translated into something that you would see on a screen. The other would be auditorily based. And it seems like auditory neurofeedback is sort of the main way that people are doing it nowadays, where there would be some recognizable sound pattern, like a piece of music that you're familiar with, that you're listening to, but that music is sort of interrupted or warped or distorted based on what's going on within your brain patterns, and by trying to get your brain to behave in certain ways, trying to make alpha waves versus beta waves or something like that, these disturbances in the audio that you're listening to are reduced, and so you sort of have a feedback mechanism that is as close to real time as they're able to get. Obviously, the more real time, the better, and in doing that, you're able to train your brain to behave in certain ways. So there's a lot of different strains of neurofeedback neurofeedback out there, everything from those that are very physician-directed, where a doctor or clinician would be trying to get you to aim for a certain brain state, or letting the brain listen to itself and fall into a pattern that sounds harmonious to it, more of a self-guided neurofeedback. Anyway, that's probably enough in the way of preamble, so let's dive into this interview with Dr. J. Lucas Koberda and learn about what the LORETA method of neurofeedback is and what he's got going on down in Florida.
Smart Drug Smarts.
Well, neuromodulation is very broad area. We call it also neurotherapy, and that includes a lot of techniques for influencing the brain. I think the most well-known and that the people are familiar with is electric shock therapy, also called electroconvulsive therapy, when the people who are depressed and do not respond to medication are subjected to high electric voltage and they develop seizure, and after that hopefully they have depression which is improving. So that's one of the oldest forms of neurotherapy or neuromodulation. They are newer forms of neuromodulation which include non-invasive techniques like, for example, neurofeedback, which is a self-regulation technique, and there is also other technique which has been approved by FDA in 2008, I believe, which is called transcranial magnetic stimulation or TMS. Some other modalities may include direct transcranial stimulation. Also, there are some invasive techniques like deep brain stimulation, when you put actually electrode to the brain, to the area which is dysregulated, in order to improve patient condition. In case of depression, for example, there is what they call DBS, deep brain stimulation technique, when they put the electrode to the anterior part of corpus callosum, which is structured in the brain, and apparently they have some success. So that's a kind of description of neuromodulation.
Yeah, that's interesting. I knew that they were doing basically invasive therapies for people with heavy Parkinson's disease. I didn't know that was something that they had also applied in cases of depression.
Yes, in depression there is another technique which also was approved, which is called vagus nerve stimulation, when you actually hook up the electrode to one of the nerves which goes to the brain and stimulate it, and then apparently that also shows some positive benefits. But the problem with those invasive techniques is, number one, that requires surgery, so potentially the surgery can be having complications like infection or bleeding, and also they are very expensive because they require hospitalization. So many times this type of surgery may cost, really a fortune. So those techniques which are not invasive and which could be done in the office type of settings are much more cost effective.
Sure. So with that sort of spread of different things, all of which fall within the neuromodulation realm, what made you choose to focus your work on neurofeedback? What was attractive to you about that?
Yeah, in my situation, it was an interesting story. I moved actually to Tallahassee, where when I moved 7 years ago was a pretty good number of neurologists who already seen almost all of the patients. So when I started seeing those patients, they already try most of the conventional therapies, including medications. So when those patients were seeing me, I was really kind of not having too much to offer, because I had the option of really telling the patient, well, it's nothing what can be done for you because everything has been tried, so go somewhere else. Or I could try the same medications which already gave them some side effects or did not help, which also wouldn't be a good option. Or I could explore some new promising technologies which could be given to those patients. So actually, when I was in Tallahassee, initially there was 2 psychologists who were using neurofeedback for treatment, and they were using very simple technology which was discovered approximately 40 years ago, and they were using these neurofeedback machines which used 1 or 2 sensors, 1 or 2 channels, and those are effective. However, usually takes a lot of time for those therapies to be successful. So I started exploring this technology. Several patients of mine, which I sent to those psychologists, which I started to collaborate, responded. So I knew there is something good about this technology. And at the same time, I started exploring what would be the best equipment and technology of neurofeedback to use in my patient. I discovered that presumably one of the best options on the market is LORETA neurofeedback, which is based on not only 1 or 2 sensors, but is based on the 19 sensors, which are placed in the form of the cap on the head. And the advantage is that you can train the whole brain at the same time, instead of training just 1 or 2 spots on the brain, which may be affected, and also gives you additional ability of doing 3-dimensional brain maps, which has not been achievable before with the old technology. So that's really, what's prompted me to move toward neurofeedback. neurofeedback.
So can you tell us, LORETA, that is an acronym, stands for something. It's LORETA. What are the acronym parts there?
Yeah, I will tell you a little bit. LORETA, stands for, it's a long name, Low Resolution Electromagnetic Tomography Analysis. And that's a technology which was developed by a scientist who was working in a Swiss university called Key Institute in Zurich, in Switzerland. And approximately 15 or 20 years ago, he, I believe, was mathematician, and he developed mathematical way of approximately localizing the electrical dysregulation in case of many neuropsychiatric conditions. So what it really gives us is localization of the electrical dysfunction. We know that almost everything in our body is based on electrical energy. So if we would like to move the muscle, we have to use electrical energy to accomplish that. If we want to say something, we have to use electrical energy. So that's really what's happening with the brain. When we have neuropsychiatric conditions, most of the neuropsychiatric conditions, when you do the brain maps based on this electrical activity and compare this electrical activity to norms, because of course you have to have some normal people to compare in order to see if this dysregulation, electrical dysregulation, is really significant. So they are different normative databases, and the one which I'm using is coming from Tampa area. And then when we can localize this...
Are you saying that there's normal people in Tampa, Florida? I know some people that would disagree with that.
Yes, well, it's a more than 1 million population, so you can choose some. Yes, of course, it's more and more difficult with time, but it's still you can pick up a few hundred people who at least seems to be within normal limits.
So let's see. So you were talking about there are 19 different sensors on the scalp in LORETA Neurofeedback. Are these sort of placed everywhere across the scalp just to get as much coverage as possible, or is it trying to cover specific brain regions per se?
Yeah, well, the CAP system, which is used, is based on a traditional system 1020, what we call when it covers the whole brain, and they are, all representation of all the cortex areas, frontal and parietal, occipital, all areas are covered. So we have kind of representation of every area in the brain.
Yeah, that's one thing I wonder, because I mean, you hear a lot about these areas being generally devoted to one brain function or another, but then you also hear about how amazingly plastic the human brain is, and how one person's brain might not have the same sort of functional abilities morphologically in the same spot as somebody else's. And so I was just wondering, if you need to sort of fine-tune the placement of the cups depending on individual differences.
Yeah, it actually makes it easier. With the new technology, of course, it's more complex. The computer programs are very expensive sometimes. It may cost, close to $10,000, $15,000. But at the same time, it makes easier for diagnosis, because 20 years ago, when we had no advanced computers and we were using this 1 or 2 sensor technology for neurofeedback, we were kind of guessing. So if, let's say, the patient had depression, we were assuming that this is a frontal lobe. So we were placing the electrode in the frontal lobe and trying to regulate, self-regulate this area. Currently, what we are doing, we are actually matching the patient's symptoms with brain maps, which are coming from this generated brain maps from this technique. And we exactly can see where is area of dysregulation. So we are having like a maps that we can follow, and we are not blinded whatever we do. So we can actually program the computer and have a successful therapy without making major mistakes. So that's a big advantage comparing to the prior systems.
So tell us exactly how neurofeedback is working. A person sits into the chair, they get the cups put on their head, and then they get feedback in what way, and how long does it take before the brain starts to pump information back in a way that is clearly affected by the neurofeedback system?
Initially, we identify the area of dysregulation. And we use actually a Z-score, which stands for standard deviation. And initially, we use a high Z-score value, which is easier for the patients to be training. And actually, for the patient, we ask them usually in case of auditory biofeedback, in case, for example, when we use only the music as a biofeedback, and we give the instruction to the patient, well, focus and try with your thought to play the music continuously. And we usually try to give what we call 60% reward. So we try to let the patient play the music at 60%. And when they do it very well, that they concentrate and they change the brainwave pattern, dysregulated brainwave pattern to correct themselves, and they start to play 100%, then we make it more difficult. So we, what we call, decrease the Z-score. And then usually with LORETA Z-score neurofeedback, it's usually much faster way to achieve positive results. Historically, with one or two sensor neurofeedback technique, we needed really 30 to 50 sessions to see really positive results. And with LORETA Z-score neurofeedback, sometimes we can see improvement after 3 to 5 sessions. So that's really is very important, because you can save the time, and the patient's also compliance increases, because if the patient has to come so many times to your office, let's say 20 to 40 times to your office, many patients just cannot do that. So having just fewer sessions to achieve the results is very much beneficial in this situation.
And so what exactly is the Z-score measuring? What is that based on?
Well, the Z-score is measuring, if you remember the standard deviations, if you have one standard deviation, if I remember well, is approximately 67% of the people who are tested fall into that range. So the brain maps are color-coded. So those patients who have electrical activity which falls to this one standard deviation, and we create the brain maps, they are color-coded and they are usually green. So patients like to see that. They are very visual. So they see that the brain maps looking completely normal. If they are out of one standard deviation, if that goes to two standard deviation, that it's getting closer to 97%, and three standard deviation 99%, then the brain maps color changes to red. So what the patient actually, in addition to auditory feedback in form of the music, which is becoming interrupted or more continuous, they also see how the brain maps are improving in the color. So they see exactly how the dysregulated area of the brain in red is changing to green, which is also additional way how to motivate the patients that they are having results, successful results.
Now, if I'm understanding correctly, sort of the baseline that you're working from would be what the average person on the street's brain would look like. How do you know that if you see a dysregulated area or something where a person is, a standard deviation or two different from the norm, that's necessarily something that needs to be corrected, rather than, that's that person's particular stroke of genius?
Well, we always try to, before we subjected anyone to neurofeedback, we always complete the medical history. I usually spend 1 hour with the patient and talk about their problems. So let's say if the patient is depressed, then I would expect that there are some dysregulation in the frontal areas. So that's how it works. You don't usually accept any dysregulated area of the brain as symptomatic, because you always have to associate that with the patient complaints. And then when it's exactly the same area which the patient is describing the symptoms, then this is area we have to focus on.
I see. Yeah, that makes sense. They recently did some studies on Albert Einstein's brain, which has been preserved, and found that he had, I guess, a much larger corpus callosum than your average person. So, a lot of more connectivity between the hemispheres. But I was worried that somebody, because, he's obviously several standard deviations off in that particular thing, that maybe that would be viewed as a bad thing rather than a good thing if you're just looking at what the average brain looks like.
Yes, well, definitely. I think that Einstein wouldn't need too much in brain enhancement, except maybe some social skills. I think he was a little bit off with social skills.
Right.
So we could improve those maybe a little bit.
Do you, in your practice, ever work with people who are not necessarily looking to cure an ailment or help with a problem, but are simply looking to sort of take their own cognition to the next level?
Yes. Well, as you may know, at Tallahassee, Florida, there is Florida State University. It's close to 50,000 students, and there are also some other universities in Tallahassee. So it's really a lot of emphasis on the grades and how they do in school. So we actually had sizable group of students who were doing reasonably well at university. However, they wanted to improve their grades. So we published actually 2 papers on 2 cases. One of them was a 23-year-old dropout student, actually, who dropped out from the college and had what we call a low information processing speed and a little bit memory problems. So those folks who have memory problems or cognitive problems, we actually, in addition to doing the brain maps, we also run the computerized program, which takes maybe 45 minutes. They sit in the front of the computer and the questions come from different categories and they have to answer that yes or no. And then we compare those data to people of their age and education. So we again use statistics to see if they are having intellectual problems comparing to those folks. And then we see exactly which area of the brain is also not functioning. So in addition to having the brain maps which show electrical dysregulation, we also have those data showing if they have memory problems or information processing problems and so on. So we actually can do that before neurofeedback and then program the computers for neurofeedback to improve these faculties. Mm-hmm. And after 10 sessions, I usually do 10 sessions. I see them like twice a week for 5 weeks. And after these 10 sessions, we check this program again with neurocognitive status and we see if we're able to enhance those folks. And in most of the cases, I would say 70% of the patients, they respond very well. So we have follow-up with cognitive testing, but the most really important is a follow-up in real life. So for example, this patient who was dropped out from community college, he was admitted to a much better university after that. And now he comes to my office because he wants to improve the grade. He was a little bit autistic, but he was still functioning very well. He had B's and C's and A's, and he was not very good with English and philosophy. So he wanted to increase the grade. So we also program him. We identify the area of dysregulation in the speech area, and we self-regulated this area. And after 10 sessions, he was able to come back to university, and he improved his grades from C to B and A's. So that's really what we do. We try to identify the areas of the brain which are dysfunctional and try to tune it a little bit and make them more successful in the school. And the same you can do with executives, for example, who work on high positions, frequently stressful positions, and they need to improve their concentration, reduce anxiety. So those are the people who really don't have a major sickness, but they would like to improve their functioning in a current position.
Right. How would you say that sort of your client base stacks up? What percentages are those like people that are trying to overtly solve, I guess, what would be considered medical problems versus people that are trying to deal with things like, stress or just optimization?
Well, now it's becoming a little bit gray zone because it's really very difficult to dissect where these people who, for example, have attention problems and may have mild attention deficit disorder, but they are still functioning as engineers or attorneys, if they really, where they are. Because, of course, insurances would prefer not to pay for those individuals. But on the other side, those individuals would like to be more successful and do better. So that's a difficult line to draw. I think it's a lot of people who fall into this category. I would say that maybe 10% of my practice may be the people who really want to increase their ability to perform. Those also include the people who are in competitive sports. I had recently a horse riding young female who was very anxious before the competitions. So she was very anxious to the degree that she was, having palpitations and nausea, vomiting. So we did, I believe, 15 sessions of neurofeedback focusing on anxiety and improving the concentration, and her symptoms subsided. So I think that's, one of those cases that you would say, well, she was not really disabled or she was not really ill or sick person, but, she really needed this kind of neurofeedback to improve her performance in her sport.
Yeah. Everybody's sort of somewhere on those spectrums of attention and stress. It's like you don't avoid stress entirely until you're dead. Obviously, everybody's got some attention span, at which point they're going to get bored. And so it's a little bit artificial to wall off, whatever it is, 1 sigma off and say, this is ADHD versus this is a normal person. Nobody really knows.
I agree fully. So we have more and more people who are interested, and also, not too many people are aware that those technologies are now existing. And that's really because of the advance in computer technology and neuroscience at the same time.
Yeah. That was one question that I've asked before when we've had other people on the show talking about neurofeedback is it seems like such a great technology. I'm kind of surprised surprised that more people aren't aware of it, more people aren't doing it. Why do you think that this hasn't caught on with the general public more than it has? I mean, it's still a very sort of fringe thing.
I think within the next 5 years, you will see that we really accelerate. I see currently that the number of physicians and scientists involved in neurofeedback is increasing. So you have a lot of universities who utilize a different form of neurofeedback, including functional MRI neurofeedback for research. However, where is the problem? Problem is that functional MRI is very expensive. It costs several $1 million, and one session costs approximately $800. So it's really not doable in the clinical settings in the real life. So that's why LORETA neurofeedback is the answer to those patients, because these sessions are very inexpensive and they can do the same results as functional MRI neurofeedback with a fraction of the cost.
Is LORETA neurofeedback something which is covered normally by health insurance, or are people paying out of pocket?
Unfortunately, now it's not yet covered by most of the insurances. However, I think it will change as well, because once insurances will realize that they can save money. I will give you an example. One of the patients of mine was attending electroconvulsive therapy, shock therapy sessions. Those sessions has to be done in inpatient settings, and because it requires anesthesiologists and all the medical crew. And the insurances pay $5,000 to $6,000 for one session, and the patient requires multiple sessions. And then you compare it to neurofeedback, which is done in the office type of settings. This is kind of presumably average price for neurofeedback, $150. So even if you do 20 sessions, that's going to be $3,000, which is a fraction of the one session of electroconvulsive therapy. And of course, there is no side effects.
You mentioned there that there are no side effects to neurofeedback. And I mean, that does kind of make sense, because it's a read-only process. Nothing is going into the brain, either drugs or electricity or anything like that. So when you see a failure in neurofeedback, it's essentially just that the patient does not respond?
Well, in my office, I like to have fast results. I usually do 10 sessions. And if the patient improves, and usually they improve, I would say 70% within 10 session response, which is very good. So if that's the case, then we continue. And then if we are not able to improve the problem within 10 sessions, I have a discussion with the patient, and we say, well, we can change the protocol, or we can use some other modalities. Transcranial direct current stimulation. Another one is very low frequency magnetic stimulation. And when you combine it with neurofeedback, that is able to increase efficiency and response of those patients. So I think applying multimodality therapy will be able to reduce the number of non-responders to practically zero. That's in my opinion.
Gotcha. Is this something where you're training neurons to fire in a certain way, or are you actually seeing the growth of new axons? I'm just wondering how much is structural change versus tuning brain systems that are already there?
Yeah, this question can be answered very well by the paper which was recently published by University of Montreal group, Dr. Mario Bogart, and they've done very interesting experiments. They had the normal students, and they had randomized studies. So some students were assigned to the experiment group, which was subjected to neurofeedback, and another group was subjected to what we call sham neurofeedback. So they really had fake neurofeedback.
Right.
And they stimulated attention network, and they've done functional MRI before neurofeedback and after neurofeedback, and they completed, I believe, 40 sessions of neurofeedback after the MRI was completed again. And they also done attention testing. So what they found that the group, which was experimental group, who was subjected to neurofeedback, but not the group who was subjected to sham neurofeedback, they had increased attention after the testing, after the neurofeedback. And at the same time, when they've done functional MRI, they identified new creation of neuronal structures in the white and gray matter of the brain. So that really shows why the neurofeedback is so effective, because it's neuroplastic, creates new neurons and creates new connections. So changes how the neurons discharge, and also stimulates the neurons to development and growth.
Well, thank you very, very much much for joining us. Is there anything else that you'd like to circle back to, drop a last point on people before we call it an interview?
Well, I think very important to mention is that the neurofeedback is entering area of professional sports. So I went for one of the conferences lately, and apparently Canadian skiers who are preparing to Olympics and who are preparing to prior Olympics, most of them are subjected to neurofeedback to improve the concentration and reduce the anxiety. So I think this will be the area which will be more broadly entering the lives of many professions.
Yeah, that's interesting. I'm guessing that probably any sort of professional sports augmentation technique that's going to not show up on a drug test is probably something that people are looking at very aggressively right now.
Yes, well, we would call it computerized doping.
Yeah.
So that would be definitely the area that we can utilize, focusing on the brain and improving the brain and improving the performance.
Cool. Well, Dr. Koberda, thank you very, very much for joining us.
Thank you so much. It's a pleasure talking to you, and I hope neurofeedback will be spreading as fast as it has started, because I see really incredible progress in neurofeedback and related technology.
All right, so thank you very much to Dr. Koberda for that interview and letting us know all about the latest of what's going on in the world of neurofeedback. Neurofeedback is something I'm really excited about because it seems like something it's hard to imagine that it couldn't be safe. It's hard to imagine what the danger of sort of a read-only technology like that is, but I think there's also the potential in the fairly near future of having technologies that would incorporate some of the reading aspects of neurofeedback with some of the more brain stimulation aspects of some other technologies to really kind of computer us out a little bit more than we have been in the past. Anyway, interesting stuff to think about. But as promised, let's jump over to the unexpected upside of alcohol and the ruthless listener retention gimmick.
Smart Drug Smarts. Ruthless listener retention gimmick.
Okay, so it's been Christmas season, it's been shopping season. We've all been digging into our wallets maybe a little more than we normally do for the obligatory seasonal gifts and stuff. And I stumbled across this report that drinkers earn more money than non-drinkers. And I thought this was maybe not surprising, but a little bit funny and worth sharing with people. Drinkers apparently earn 10 to 14% more money at their jobs than non-drinkers. And there's varies along gender lines too, interestingly. Men only earn about 10% more as drinkers than they would as non-drinkers. Women, it's 14%, so a little extra boost for the women out there. But men get an additional 7% in pay if they hang out at bars at least once a month, whereas women did not have any particular benefit from bar visitations. So read into this what you will. I mean, the researchers didn't really comment on what some of the reasons for this might be. Obviously, a lot of socialization goes along with drinking, and being a social person is probably never bad for your workplace performance or status or whatever, and maybe is enough to overcome having a little bit of a hangover on some days or whatever. Obviously, this is one of those things where we should bear in mind the differences between correlation and causation. This is a correlational study, not a causation study. Causation is a whole lot harder to prove, and maybe we'll have a correlation versus causation episode sometime just to kind of get people's brain to wrap around that idea. But anyway, yeah, something to make you feel a little less guilty if you're swilling some alcoholic holiday ciders or eggnogs or something like that. So that's it. That is the episode 25, coming in for a landing. If you liked what you heard, please recommend this podcast to your friends and leave us a review on iTunes. The show notes for this episode will be online at www.smartdrugsmarts.com, including the links to all the stuff we talked about here. I will be back at you next week. It'll be both the first episode of the year and the first episode next week. But yeah, 2014 coming right at us. I've got a lot of plans for Smart Drug Smarts in the coming year, and I'm very excited to have you listening. So thank you very much. Have a great week and stay smart.
You've been listening to the Smart Drug Smarts podcast. Visit us online at www.smartdrugsmarts.com and subscribe to our mailing list to keep your neurons buzzing with the latest in brain optimization. Smart Drug Smarts should be listened to for entertainment purposes only, although some guests on the show are medical doctors, most are not, and the host is just some random guy. Nothing you hear on this podcast or read at smartdrugsmarts.com should be considered medical advice. Consult your doctor and use some damn common sense before doing anything you think might have a lasting impact on your brain.